Imagine stepping into a high-tech clinic, right? You're surrounded by glowing screens.
Sure.
But what actually separates the $200 monitor on your desk at home from the $1,600 Hall Technologies 27-inch medical monitor staring back at you in the ER?
Right. I mean, it looks similar at a glance, but it's a completely different beast entirely.
Exactly. So today we're pulling from a really detailed product page via HT-TVSupply for the HT-HVMT27. We're doing a deep dive to see what transforms a standard piece of desktop hardware into a highly specialized medical-grade tool. So, okay, let's unpack this.
Well, the difference really comes down to the margin for error. Standard monitors are built for consumer convenience, whereas a medical monitor, it has to be built for absolute precision.
Because you're looking at a 27-inch screen pushing 2K resolution, right? Like 2560 by 1440 at 60 hertz, which sounds great for gaming, but here it's different.
Yeah, exactly. Plus it has HDMI and DVI inputs and, built-in stereo speakers. But in a clinical context, 2K isn't about sharper video games. It means a physician can pull up multiple high-resolution diagnostic windows side by side.
Oh, without sacrificing any of that pixel fidelity.
Spot on. And then there's how they physically interact with it. It uses capacitive touch, which relies on the electrical properties of the human body.
Kind of like a giant, flawlessly responsive smartphone. I mean, think about how frustrating a lagging screen is at home, right?
Oh, absolutely. Now imagine that frustration during a medical emergency.
Yeah, that would be a total nightmare. Plus, it's designed with this completely flat glass screen, so there are no deep physical bezels.
Right, which is huge for infection control because there's nowhere for bacteria to hide. But what's fascinating here is the psychological and operational impact of that interface.
Oh, how so?
Well, think about the stress of a trauma bay. If a nurse is interpreting live video feeds or vital signs, a stuttering, lagging screen actively delays critical decisions.
Right, you just touch the data and it responds instantly. Even if a doctor is wearing thin nitrile surgical gloves, they don't need heavy physical pressure.
Exactly. That frictionless interaction streamlines the entire workflow, and literally every second counts.
But speed and a smooth interface are kind of useless if the monitor itself fails, right? Or if it compromises the room somehow.
Yeah, that's where the actual hardware certifications come in.
Right, this model carries specific medical ratings, specifically IEC and EN 606011 and 606012.
Those certifications act as an invisible shield. Quite literally. It means the hardware is heavily shielded against electromagnetic interference.
Wait, so if you put a standard consumer monitor next to a sensitive piece of equipment like an ECG machine?
Its electromagnetic noise could literally scramble the patient's heart rate reading.
Whoa, really? That's terrifying.
It is. So the certification guarantees the monitor operates silently in the background, electrically speaking, so it won't interfere with life support tools.
Okay, but here's where it gets really interesting for me, though. The monitor also features a lockable on-screen display, or OSD menu. And my instinct is to ask, is someone accidentally bumping the brightness or contrast really that big of a deal?
Oh, it's a massive deal. In diagnostics, an altered display setting could radically change how a medical image is interpreted.
So, like, if the contrast gets bumped up too high,
A faint shadow on a scan, which, could be an early-stage tumor, might just disappear entirely into the background.
wow. Or a normal tissue variance could suddenly look like a massive problem.
Precisely. So locking the OSD ensures absolute consistency every single time that monitor is turned on. The baseline never shifts.
That makes total sense. You pair that lockdown consistency with its rated 50,000-hour lifespan and a solid 3-year warranty, and you have a machine designed to be relentlessly reliable.
Absolutely. It proves that in healthcare, reliability and security are just as critical as the resolution itself.
So the next time you visit a hospital or clinic, you'll probably view those workstations a little differently, knowing about the rigorous electrical shielding and those hidden lock features working behind the scenes to keep your diagnostic data secure.
Yeah, and it raises an important question to think about. As touchscreens and healthcare environments become as intuitive as our personal smart devices, how might this seamless physical interaction with complex diagnostic data ultimately change the way patients engage with their own medical care?
That's a great point. Maybe when you step back into that high-tech clinic of the future, the screen won't just be a lockdown tool for the doctor, but a shared, highly accurate window into your own health. Something to think about.